We are introducing a structured approach to patient handover and escalation within your community hospital. SBAR is a technique used for communicating important, often critical information that requires immediate attention and action. SBAR looks at the situation, background, assessment and recommendations regarding a patient's care. SBAR is a communication technique developed by the military specifically for use on nuclear submarines. Health organisations throughout the world have adopted this technique as a structured handover of patient care. This is especially useful when patients are deteriorating and the importance of a situation needs to be expressed. On the left-hand side, there is an example from the NHS guidance of how to do an SBAR handover. I will ensure these are available in all ward areas for you to reference. So we're going to look at the 4 areas. Situation. Briefly but clearly describe the situation. In this step, the nurse's role is to identify key information, including the patient's name, room number, unit where the care is being provided, and your role in the patient's care. Explain the circumstances surrounding the problem, which include what the problem is, how the problem occurred, and the severity of background. After identifying the situation that needs to be addressed, it is necessary to provide relevant background about the patient. Include the date and time of admission, readmit and diagnosis, any specific laboratory and diagnostic test results, and the patient's resource status. The largest part of the handover is within the assessment category. You need to talk through what you think the problem is. For example, I believe my patient has pneumonia and she has a red flag for sepsis. You then need to talk them through the ABCDE approach of your patient's observations. This is all documented clearly on the chart for you to follow through systematically. Do not be afraid to express your concerns and make a recommendation for care to the appropriate team member. Within the community, this may be needing a GP to come out and assess or getting the patient back into hospital via a 999 call. So let's look at a scenario. You're looking after Mrs. White and she is 78 years old. She is staying in your community hospital following a fractured neck of femur 2 weeks ago. She is usually independent and volunteers in a library. You have taken her observations and her new score is 7. It was 2 previously. She is requiring supplementary oxygen and looks very pale. Her past medical history is type 2 diabetes and gout, which she controls well with diet. You escalate to the advanced nurse practitioner who happens to be working on your ward that day, and a decision is made to call 999 and ask for an ambulance to get this lady back into the emergency department. This can often be quite stressful. The patient may have a large bundle of notes. You don't know them that well because you only just took handover, and you know that the people on the other end of the call are going to ask lots of questions. Take a few minutes to fill out an SBAR form and this will guide your handover and you will feel a lot more confident. Now you've filled out your patient details, we can escalate. So, hello, my name is Camilla. I'm working on Waverley Ward in Harwich and I have a deteriorating patient. I am concerned about Mrs. White. Her new score is 7. She is requiring supplementary oxygen and has a red flag for sepsis. I believe she has a chest infection and potentially sepsis. This lady was admitted to Harwich Hospital from Colchester Hospital yesterday for rehab following a fractured neck of femur 2 weeks ago. She is receiving physiotherapy and analgesia. I have just completed a sepsis screen and IV fluids have been commenced. She is for full active escalation. I think the problem is pneumonia and she has a red flag for sepsis. Her airway is fine, her respiratory rate is 23 and her SATs are 96, but she is requiring 4 litres of oxygen via nasal specs. This is new for her. Her heart rate is 121, blood pressure 101/67 and her central capillary refill time is 3 seconds. Her blood glucose is 6.8 and her pain score is 0. Her temperature is 37.1. Within your recommendations, you need to be firm of what you would like happening. I need you to send an ambulance to return this patient back to the emergency department as I believe they might have sepsis. Finally, we need to document who we've let know about the patient's deterioration, what time we let them know and when they attended. We need to photocopy this piece of paperwork, sending one with the patient's notes and keeping one at your community hospital.